Hello, I'm Dr. Omar Bey, and this is A Moment in Medicine. Our focus is health, education, and wellness. Our goal is for each and every one of us to have that opportunity to grow old in good health. Welcome to our show. I'd like to talk about caring and sharing. And what we mean by that is that each of us have med moments. And a med moment is that time when you had that chest pain or that shortness of breath. And those episodes let us understand that we need to take better care of ourselves. If we let others know about our med moments and how we got through those, they may be inspired to take better care of themselves. Go to www.medmoments.com. Email me. Let me know about your med moments so that we can truly share and ultimately care for each other. We have a great show for you tonight. And our topic is the eye. It's a very interesting topic because vision is so important to each and every one of us. I have an expert on the eye. He is Dr. Winston Scott, and he's an ophthalmologist. Dr. Scott, welcome to our show.
Oh, thank you. My pleasure being here.
All right. You know, this is a very interesting topic to me, but it's one that's a little foreign to me because me being a pulmonologist, I rarely concentrate on the eye. So right. I'm going to listen intently tonight.
Okay.
I'd like to start off with just explaining the eye, the parts of the eye, and just give us a better understanding of how it works.
Well, let's start from the outside and move in. When you look at the eye, you see a whiteness to the eye. That's called a sclera. And on top of the sclera, there's a very light covering with a lot of blood vessels. It's called a conjunctiva. Oh, wow. Now, very often someone get a red eye or a pink eye. It's actually those blood vessels in that light covering, the conjunctiva, that gets inflamed and injected, and that's what makes the eye a red eye. The next area we'll get to is an area called the cornea. And the cornea is the very surface of the eye where very often if you wear a contact lens, that's where the contact lens fits, right on top of the cornea. Mm-hmm. And the cornea is also very important to help the eye to focus. Okay. Now as you go inside the eye, there's an area called the anterior chamber, and it's filled with liquid. And behind that is that pupil, which can open up or close depending on the amount of light that comes into it. Mm-hmm. And behind the pupil is the lens. The lens is what helps to focus, yeah. And that's what later on can become a cataract. And we'll talk about that a little bit further. Mm-hmm. And then behind the cataract, behind the lens, is an area called the vitreous. It's a gel that fills the eye and gives it shape. Oh. And then further behind that gel, the vitreous, is the retina, the neurosensory part of the eye. And right behind that on the back is the optic nerve, which is actually a little part of your brain that you can actually see inside the eye.
Oh boy. So when they talk about the eye as the window to your soul, you basically that's what you're talking about. You're really looking in there, aren't you?
Absolutely. And one important thing, the eye is really the only part of the body that you can look in and see the normal blood vessels at work. Oh. And very often the integrity of those blood vessels tell you pretty much how things look in the kidneys, in the lungs, in the heart. Mm-hmm. So it's a good way to take a look without having to open someone up and looking at the blood vessels.
Interesting. Mm-hmm. Well, it seems like you described the camera. Right. When you're talking about the lens, all of this kind of stuff, it just seems like a camera. So it's pretty intricate. You know, I'm just so impressed sometimes when I look at the model of an eye, and we have a model here, right. Basically how many parts to the eye there are in order for it to work for us in an appropriate way. All those little parts have to work in a particular way as well.
In unison, and it's interrelated to the rest of our body. You can't separate them. something goes wrong with the rest of the body, sometimes that's the first time you'll know that there's a problem by the eyes, by the way the person sees, by the way the eye looks. Window to the soul, window to the rest of the body.
Yes, yes. Let's talk about a particular disease. I'd like to talk about diabetes. Reason being is because it's so prevalent throughout all communities. And I know the eye is, diabetes affects the eye greatly. And there are other diseases that we will touch on, but let's start with diabetes and the eye. Can you give us some idea?
Well, diabetes is a disease of blood vessels, and blood vessels run in every part of the body. So when you have diabetes, it can affect any part of the body. And the eye is no exception. The eye has a lot of blood vessels. What happens, very typically, the diabetes can be, the diagnosis is made in the ophthalmologist's office. Now, someone, the symptoms of diabetes, you could have urinary frequency, go to the bathroom a lot, you're drinking a lot of water. Summertime, you're thirsty, you're drinking. I'm just thirsty. I'm drinking a lot, so I'm going to the bathroom a lot. But what happens is, when the sugar gets too high, it can affect the vision, and the vision drops. Now, when the vision drops, people come in right away.
Now, when you say drops, you mean it gets cloudy on them?
It gets cloudy and they lose sight. It gets really blurred, and it's very dramatic. And that, if the frequency and urination doesn't take them in, definitely when their sight goes, they'll come in often.
Now, what actually happens? Is it that when the blood glucose gets high, or the sugar in the blood gets high, does it get high in the eye as well? Is that why you?
What happens is when it gets high, the lens in the eye, which makes you focus, draws in liquid, and the fluid causes the lens to swell osmotically. Excuse me. When it swells, it blurs the vision. Now, you can give someone insulin or diabetic medications to bring those sugar levels down to a good level quickly, but that swelling in the lens sometimes takes weeks to go down. So the vision will remain blurred for quite a few weeks. And that's not a good time, actually, to change your glasses. Very often, if you go to the wrong eye doctor and they do not realize that there's a problem, you can end up with a pair of glasses. And then a month later on, when your blood sugar changes again and the lens comes down to the proper shape, those glasses are too strong for you. So it's very important, where do you go to get your eyes examined?
Right. Now, you're saying that, what are other changes in the eye with diabetes? Do the vessels in the back change as well?
Yes, very important. Diabetes is one of the major causes of vision loss in the country. In fact, it's the number one cause of vision loss in the working population. In the diabetic eye, the blood vessels get weakened and they can actually leak. And this excess blood and liquid in the back of the eye causes the vision to drop. And it really drops off tremendously. Now, the other part, the body can try and repair itself, and it forms new blood vessels, and those new blood vessels are very fragile, and they can bleed easily, and that can be a major problem. So diabetes can not only affect the glasses, the way you read, but it can also affect your overall vision, and it can also cause you to go blind. It's one of the major causes of blindness in the working population.
So I understand that diabetes is a chronic disease. So you cannot get rid of diabetes. Once you have it and you're taking insulin, if you maintain your blood sugar the best you can and keep it in that range that we feel is normal, do you protect the eye to a certain degree?
Well, it certainly helps. But we've also found that sometimes it has to do with the length of time that you've had diabetes. We have patients who do very well controlling their blood sugar, but they've also had diabetes for 15, 20 years. And after 15, 20 years of having that little excess blood, extra sugar in the blood, it does weaken it anyway. So sometimes patients, even with good control, will also start to cause bleeding in the eye. But by all means, the better control you have, the better off you are.
Okay, all right then. Well, there's other problems as well. And another one that's in, throughout and I hear it all the time, high blood pressure. Now, high blood pressure can cause heart disease, just like diabetes.
Yes.
It can cause kidney disease, lead a patient to dialysis. It can cause, so many other problems throughout the body. I know that the eye, being as sensitive as it is, it must affect that as well.
Oh, absolutely. It can affect it in major ways. The blood vessels in the eye, the veins and the arteries, they share a certain layer together. And as the blood is going through at a higher rate, it can cause damage to the arteries. The veins can cause damage to the arteries can cause damage to the veins, and you can have bleeding in the back of the eye. And again, it can be quite dramatic, and it can cause your vision to be lost. Also, this very high blood pressure can cause these blood vessels to leak. Fluid will leak in the back of the eye, and it can cause a swelling in the eye called hypertensive retinopathy, and it can cause the vision to drop tremendously.
Okay, so what we're talking about is that if I'm not taking my blood pressure pills appropriately, or if I miss a couple doses and over time and the blood pressure is really high, what you're saying, I know that my pressure in my arm and everywhere else is high. Those tiny blood vessels in the back of my eye, the blood pressure is very high in that too.
Absolutely.
All right.
It's interconnected. Can't separate the eyes from the rest of the body.
Okay.
And yes, it can certainly cause, it can have a stroke in the eye.
Oh.
Just as you have a stroke on the brain, the blood vessels coming through the neck, one of the first branches, it goes towards the eye. The same blood vessels, the same problems that you can have on the brain, you can have it in the eye. So sometimes you'll have a little decrease in the flow in the eye, and somebody says, I did not see for a few minutes or for an hour. That's a warning sign. You could have a small stroke in the eye, and then later on it moves to the brain, because it's the same blood vessels moving upwards. It just gets to the eye first.
Now you're talking big words there. When you say stroke, do you mean that the blood vessel spasmed, or do you mean a little piece of something got lodged in the blood vessel there and stopped the flow?
It can actually be both.
Oh.
If you have problems in the neck, the blood vessels in the neck, you could have a little plaque, or a little particle from the neck.
Like a piece of calcium or something like that?
It'll break off, and it can go to the brain and cause a stroke, but it can lodge in the blood vessels in the eye also, have a local stroke in the eye.
Oh.
In addition, you can have a bleed, just like you'll have a stroke that causes a bleed in the brain. Same thing can happen inside the eye. You can get a stroke inside the eye.
Very interesting, very interesting. Now, I know that so many of my seniors come to me and they're talking about, oh, Dr. Bay, I can see. I went and had this cataract out. And I'm like, oh, you did? That's nice. Yeah, doctor took the cataract. Tell me about cataracts, because I hear about it all the time. I think we should know a little bit more about them.
Well, actually, the eye is like a camera.
Okay.
And the lens in the eye is what helps to do the focusing, so the picture comes out nice and clear. When you take a camera and you take a picture, if the lens is not focusing well, the picture comes out kind of blurry.
Right.
Likewise, in the eye, if your lens is not focusing well, you're going to see blurry.
Okay.
Now, as a child, we were born, we have our lenses called a crystalline lens. But as we get older, that lens gets thicker.
Now, when you say crystalline, what is a crystalline? You mean it's thin, or is it?
It's nice and
crystal clear. Crystal clear. Oh, all right, now I got it.
Yeah, the textbook will say crystalline lens, like a crystal.
All right.
But definitely, as you get older, it gets thicker.
Right.
Cells, layers on top of layers, stay on top of the lens. It gets thicker, gets brown, discolored. And what happens is get to the point where it no longer focusing very well. It doesn't focus very well. Oh. That's when we call that same lens a cataract. Oh. And then the vision gets real blurred. Now the technology we can remove the lens, replace it with an artificial lens called a lens implant, and that lens will allow you to focus again like a child. Very nice, clear vision.
Now, is this a long surgery, or is this something? I mean,
it's by far probably the most common operation done in the United States today. Is cataract surgery, and it takes anywhere from 20 minutes, 15, 20 minutes. It's a quick procedure. Once you get the patient on the table, get everything set up, it's a pretty quick procedure, and the success rate is very high. I would say in the upper 90s, 98% of people see better than they saw before.
All right.
But it's still an operation.
Right.
And there is complications that can occur, but by far, most people do very, very well.
Okay, all right. Now, if you have cataracts in one eye, is it likely that you're going to have it in the other eye most of the time, or
Yes.
you can only, it can't, you understand what I'm saying?
Yes.
It usually happens on both
Yes.
eyes if it's going to happen?
Yeah, it can be quite asymmetric. You could have one and then a few years later develop another one, but very often, if it's this type of cataract that occurs due to normal aging, it usually will occur in the next eye.
Okay.
But there are other reasons why someone can get a cataract. Old trauma. So you've been punched in the eye at an earlier age, puts you at risk to develop a cataract at an earlier age. So it may be asymmetrical. It may occur in one eye, may not occur in the other eye.
Right.
Certain medications can also put you at risk.
Oh, all right.
Steroids, very common. Someone was at steroid, and sometimes it can be very subtle. You're a pulmonologist. Someone on pumps.
Oh, the
For the
inhalers.
steroid, yes.
The
Some of them who does have
inhalers.
steroid. Now, someone have been on steroids since they've been 10 years old. Now, after they're 40, that's 30 years of using steroid. Depends on how much of it they use.
Right.
Again, it puts them at risk to develop a cataract.
Interesting.
Diabetes also puts you at risk to develop a cataract.
Oh, all right.
And in some families, it just tends to occur at an earlier age than others.
Now, does that increase chances of infection or anything like that because you have cataracts, or that doesn't play into any of that?
No, not really. Not really. It usually doesn't inform. It doesn't really come along with an infectious process to it.
Right. Now, you say there are certain families that, like if your mother and father had cataracts, then there's a good chance you'll have a cataract at certain age?
Especially if they have it at an early age than normal.
Okay.
Because most people they get into their late 60s, or sometimes even in the early or to late 60s, they'll very often develop a cataract. Now, you'll find some families will get cataracts in their 40s.
Oh.
And you'll know the mom had it, or dad had it, or grandma had it, then you probably know that there's a genetic link to it.
Right, right. Now, surgery is the only treatment for cataracts? There's no magic medication that I can take this pill and poof?
Not yet.
No. All righty.
But definitely that would be something that we could definitely use, even if we could slow down the process. Now, we can't cure it, we can't prevent it, but we can do certain things in our life to slow down that process. One of the things we can do simply is wear protective eyewear. Certain sunglasses can protect our eyes versus the UV protection, the UV light. So sunglasses is a good idea. Now, some people don't like wearing sunglasses or don't want that extra expense. There are certain glasses now called transition lenses, which when you go outside it gets dark, and when you come back inside it gets light. Two glasses in one. It helps to protect your eyes. Certain behavioral habits, smoking cigarettes.
Oh.
There's a linkage there someplace with cataracts. So just help having a healthy lifestyle will help to slow down that process.
All righty. Excellent. Excellent. Now, there's another one because I know this is something that usually happens to seniors as well. It's called glaucoma.
Yes.
All right. Now, it's a fancy word and all of that, and I just need you, number one, to explain what it is, but let's get into that topic as well because it's such a common problem.
Well, glaucoma can be a very complex entity, but by far, when someone hears the word glaucoma, especially in our population, it usually means that there is a type of disease where the pressure in the eye is built up to a certain stage that it damages that optic nerve in the eye. And when the nerve gets damaged, the person begins to lose vision.
Now, hold on. Let's talk about, hold your thought with that, but let's talk about optic nerve. When you're talking about optic nerve, explain it. This is the nerve that actually comes in the back of the eye and like goes to the brain, so we understand what you explain.
Right.
It. You explain it much better than I will.
Yes, it is a nerve. It's called a cranial nerve, and
cranial mean head.
Right.
All right.
It's actually a little part of your brain because those cranial nerves are actually part of the brain. The optic nerve is actually a little piece of brain tissue, and that's probably the only brain tissue that you can actually see. Again, by looking into the eye, you can actually see a tiny part of that person's brain. That's the optic nerve. And that increased pressure in the eye. Well, again, in glaucoma, the eye normally produces a fluid that nourishes the inner part of the eye. When you have glaucoma, Well, the fluid is naturally drained out and built in ovally, continuously, 24 hours a day, nonstop. When you have glaucoma, that drainage area is very inefficient, and the fluid backs up into the eye, and this excess fluid causes the pressure to rise, and it's this extra pressure that can damage the nerve in the eye, and it can cause you to lose your sight. Now, the thing about glaucoma, and the difficult thing about it, is it's a silent disease. You can have it for many years, don't even know you have it. Because the vision you lose is peripheral vision. As you look at me, you not only see me.
Peripheral means
yes, as
the outside.
Yes, you not only see me, but you can see things around you.
Right.
Now, if you were to lose a little bit of that, means you're losing some of your peripheral vision.
Right.
You may not even notice it until it's very late. So what happens is you can lose enough of it that you can be considered legally blind. However, the little part that you still have going, the middle central vision, can still be 20/20. So it's ironic, someone can have 20/20 vision and be considered legally blind.
Interesting.
Because the blindness is based on two different ways. First, your straight ahead vision. Someone have 20/20 vision, or it's very good, that's considered very good vision.
Right.
2200 vision is considered bad vision. 2200 vision is considered legal blind. So if you have 20/20 vision, your central vision is good. However, if you have lost enough peripheral vision from glaucoma, you can also be classified as legally blind because you don't have enough of that side or peripheral vision. So it's very ironic. Now, someone could go to motor vehicle with advanced glaucoma. If they just simply test them by looking straight ahead, they can pass the test.
Right.
But when they're driving, because they have lost so much peripheral vision, they can be a major hazard on the street.
Right.
They may even lose the traffic light on top because they'll go right through it because they've lost that part of their central vision. A child coming across the street, they may not see them. They've lost their peripheral vision. So from now on, you'll see motor vehicle at times will pull your name at random, and so you have to get your eyes examined. In which case, we may have to do a visual field to check to see if you have glaucoma. We can't really check everybody. Right. But that's important.
Very interesting. Now, how do you get that pressure to decrease? I understand what you're saying, that that fluid in the eye itself, it is always gathering fluid, but there's a drainage system that allows it to drain at the same time. And the drainage, there's a problem with the drainage, so the pressure builds up.
Yes.
So what can we do to prevent that pressure from building up? How do we handle that?
Well, once the diagnosis is made, we have to treat it. We can treat it simply by using medications to either slow down the amount of fluid that's being made, or we can use that medication that can increase the excess flow out of the eye. So you can either slow down on the fluid, or you can make the fluid go out better. Now, the thing I should also mention is that glaucoma is the #1 cause of blindness in black people. Whether it's here in the United States or in the Caribbean and in many parts of Africa, it's the #1 cause of blindness. And again, it's a silent disease. You can have it for many, many years and don't even know you have it. And I have that experience with my own father. My father had glaucoma for many, many years, and no one knew that he had it. It wasn't until I was in my training and I felt comfortable enough to say, let's now examine other members of my family, and I was shocked to see what I saw. So if I went into another field in medicine, my dad would have went blind because he did not, it was not properly diagnosed, and it's a silent problem. And it's a major problem today because even sometimes when the diagnosis is made and you put someone on the medication, they say, you know, I wasn't having any problem with my eyes. The medication is expensive and it burns. I'm going to stop taking it. And you know what? They stop it for a day, nothing happens. You stop it for a week, nothing happens. You stop it for a month, really nothing happens. So they stop it altogether. And then 2 or 3 years later, they come back and say, you know, Doc, I'm having trouble driving down the street. I'm not picking up things on the side. Cars are coming out of anywhere. I'm having a couple of close calls. I've had a few accidents. It's a silent problem. They had the disease, and it went on to become an advanced disease. And the bad problem is, while if you diagnose it early, you can treat it and control it with medication, whatever you have lost, we can't retain it. We can't get it back. So you really need to make that diagnosis early, treat it properly. Now, that being said, there is another type of glaucoma called closed angle glaucoma. Now, that at least is an acute problem. The pressure went up rapidly.
Right.
And the patient knows immediately. The eye hurts, it gets red, they're uncomfortable, they come in right away for treatment. So at least that type, if you catch it early, you can not only treat it, but you can actually cure by surgery.
Okay.
But they get symptoms. The open angle type, which is by far the most common type, and the most common type that African Americans have is open angle. It's silent.
It's silent.
So it means you have to come in, get your eyes examined, and once the diagnosis is made, you have to stay on your medication. And it's a lifetime treatment.
A lifetime treatment.
Yes.
Well, Dr. Scott, let me tell you, it's been wonderful talking to you about the eye. We're going to have to, I always say this so just about every guest, we're going to have to get you back because there's so many aspects we did not have time to cover.
Yes.
And this is such an interesting and such an important topic that I think everybody should know as much as possible. You know, an educated patient is the best patient as far as I'm concerned. So we have to get you back.
Oh,
thank you very much for coming.
That's my pleasure. And I'll be happy to be back.
All righty, all righty. You know, I'd like to come to a segment, our Let's Talk segment. And I know that we don't have much time, but there's something I want to say that I think is very, very important. I'd like to come together and just ask everyone out there, let's visit a senior. And what I mean by that is that our seniors are our older population, that a lot of times they're lonely, no one visits them, they may not have family. But they may have someone that you know that they may live next door, may live down the street, or you may see them in the supermarket. So there are many times that we can go and visit a senior and understand we can take them shopping. We could go to the movies, get them out of their apartment. When it's hot in their apartment and they may not have an air conditioner, invite them over to your apartment so that they can have some relief as far as that's concerned. You can take them to their doctor, or we can just go to the park and talk. All of this is possible if we just visit a senior. In closing, remember, sharing and caring. Come to www.medmoments.com and leave an email and let me know. Remember, never institute any medical therapy until you go see your doctor. I trust that each and every one of you have continued good health. I'm Dr. Omar Bey, and this is A Moment in Medicine. Until next time, peace to you all. Thank you for coming in, Doctor.